Let's start with radiation. Now, most people would say, look, there's just not that much radiation. And if you go down to the 6th bullet point here, you see you get increased cancer risk from radiation at 100 millisieverts. What's a sievert? We'll talk about that in a second, but it's basically just a unit of radiation. And you need to have 100 times 1,000th of a sievert in a lifetime. Cumulative radiation increases cancer risk. Look at these doses over here on the side. Intravenous pyelogram, that's basically injecting radioactive dye to look at your kidneys. 2 to 3, 4 or 5 millisieverts. Barium swallow, that's looking at stomach and intestinal kind of things. 6 millisieverts. A barium enema, that's an enema, but that's looking at colon problems. A CT of the head, 2 millisieverts. If you talk about CT calcium scores, those tend to be like a millisievert. With new techniques, maybe even less. So not significant. CT of the abdomen, the stomach, 8 to 10 millisieverts. CT of the pelvis, 5 to 6. Coronary angiogram, still only 6, but percutaneous angiogram, that's doing a stent. And then guess what? Whenever you do a stent, you're going to already have done the coronary angiogram. And guess what? Anytime somebody has that done, they've already had one or more nuclear stress tests. And here's what the big issue is. One of my patients was 45 years old. And he said, when I was in my 20s, I had a little bit of a chest flutter when I was playing basketball one day. I went to a doc. He sent me to a cardiologist. The cardiologist has been doing a nuclear stress test every year since my mid-20s, and I'm 45 now. And I guess he'll continue to do them until my 60s. These guys are getting more and more radiation, and it's adding up. And as you might see under that second bullet, nuclear stress tests up to 12 millisieverts. So by the time our 45-year-old basketball player, who really had nothing significant, had had his 20 nuclear stress tests, he was up over twice the recommendation. He could have been at 240, 250 millisieverts in exposure just from nuclear stress tests. And he was in his mid-40s. He wasn't even 50 or 60. And again, he should not have been having those. So sieverts essentially measure the health effect of ionizing radiation over time. Nuclear stress tests, 2 to 12 millisieverts. Invasive angiograms going into the cath lab, 8 millisieverts. Stents, 12 to 20 millisieverts. The other term for that on the right-hand side in the image in the table is coronary PCI. So percutaneous intervention is what that's talking about. So stents, significant amount of radiation. Coronary calcium score, as I mentioned a few minutes ago, now it's less than 1 millisievert. So you've heard me recommend calcium score. You hear a lot of people that watch my channel, there used to be a lot of overlap between mine and Igor, but there used to be a lot of crossover. And then when COVID hit, he got way deep into politics on COVID. I stuck with this, so there's not as much crossover. But his channel was originally funded by an Irish businessman whose unrecognized heart disease was discovered with calcium score. So they pushed calcium score very hard on their channel. I push it too. I think it's great. I don't recommend it as strongly as a CIMT. There are problems with CIMT, and we're not going to get into all of those details today, but a well-done CIMT to me is far more informative and helpful than a calcium score. And CIMT, 0 radiation. Calcium score, less than significant. How about a CT angiogram? It's significantly more than a coronary calcium, but it's still insignificant. You're not going to build up to significant amounts of radiation from doing nothing from a CIMT, and still not enough from a CT angiogram. But from nuclear stress tests, from stents, from the typical stuff, that evil triumvirate, a nuclear stress test followed by an invasive angiogram, followed by a stent. You do all 3 of those together and already you're up to like 40 millisieverts. And that's just for one stent. How about the guys that get 8, 10 stents in the business? A lot of people refer to that jokingly as a full metal jacket, which does not prevent heart attack, by the way. But by that time, they've racked up several hundred millisieverts of radiation. Who did it help? Did it prevent the patient's heart attack? No, it won't. The science is really clear on that. Did it help pay for the hospital and the clinic and the doctor's mortgage? Yes, it did. So again, I'm sounding a little bit edgy today, but as we'll see, this is not just me being edgy, some crazy internet doc, some prevention guy complaining about interventions. We'll see a little bit later that the standards committees of the interventionists are saying the same thing. They've been saying this for years. So if somebody says to you, let's do a nuclear stress test, they're really good, or I think you need a stent, or let's take you into the cath lab and see what's really going on. It's not going to tell you what's really going on, but it's going to end up giving you some significant radiation. Nuclear stress tests count for 10% of the ionizing radiation exposure of the United States population. 10%. And you know what? There's a lot of sunshine out there. And sunshine is a major source of ionizing radiation. But the fact that a study that doesn't predict heart attacks is creating 10% of that radiation is, as you can tell, it gets me upset.